Every new parent worries about the health of their newborn. Knowing what to do when your child is ill and when to call the doctor is something that comes with experience. When it comes to your new baby, the rule is, if you're in doubt, check it out, and always trust your instincts.
When you bring your baby home, it's a very daunting time because you're on your own with the baby. It is very common for babies to pick up little bugs as they go along, and it is important to know when to worry, when not to worry. If you're checking your baby's temperature, just every time you're changing your baby's nappy, you touch your baby, so you know what your baby feels like. Perfectly normal for babies to have slightly cold hands and feet. If you feel that your baby feels hot, their tummy, the back of their neck feels warm, you could check their temperature with a thermometer. We don't recommend using a thermometer that you put into the ear because it's too close to the brain. What we would recommend is getting one of the disposable thermometers maybe and putting it across baby's forehead, or else an auxiliary thermometer. You can get digital ones that you can put under baby's arms and it reads within a couple of seconds.
Your child may have a fever if the body temperature is higher than 99 degrees Fahrenheit or 37.5 Celsius when measured under the arm. Fever in a newborn can be a sign of something serious and should be brought to the immediate attention of a doctor.
Nappy rash is very common in the newborn baby. It's oftentimes when a baby has wet and soiled their nappy. If the feces is left in contact with the skin for any length of time, it can turn into ammonia, which can cause excoriation of the skin. It looks like slightly red, and if it's left untreated, it can be shiny or the skin can even get broken.
To treat nappy rash, change your baby's nappy regularly, wipe their bottom very gently with cotton balls and avoid perfumed products. Allow air get at the rash by leaving the nappy off as often as you can. If the rash persists, ask your pharmacist for a medicated product.
It's normal for your baby to vomit back milk, but if your baby should vomit bile, which can be very bright yellow or green in colour, that's not normal, and neither is a baby who's vomiting blood.
Although in a lot of cases vomiting is actually your baby spitting up from eating too fast or overeating, there are times when this could be caused by food intolerance or an underlying infection. If an infant vomits most or all of a feed, or 2 or more feeds, you should consult your doctor.
Diarrhoea in difference to loose stools, because a baby who is breastfeeding will very commonly have yellow, watery or loose stools looking seedy. That's perfectly normal. But for a baby who's having explosive nappies after every single feed, a couple of times per feed, large volumes, there is kind of a risk of your baby getting dehydrated. True constipation is rare if a baby is fed properly, if a baby is fed adequate volumes. How we would diagnose it is if a baby is passing very hard stools irregularly after 3-4 days, their tummy's quite hard and distended, they're upset, they're straining and they're not feeding well. Jaundice is a normal physiological occurrence. It occurs in about 6 out of 10 babies. It is a yellow pigmentation of the skin. The normal pattern of jaundice is that it starts in the face and works its way down the body. If your baby is jaundiced in the first 3 days, that's perfectly normal, the face and the chest, as long as your baby is feeding well, is active and alert, waking for feeds and having wet and dirty nappies. If your baby is sleepy and thus not feeding and thus not having dirty nappies, wet and dirty nappies, the jaundice level can increase. And it is important to get your baby checked with your neonatal unit then. Signs that baby is not well. If you check your baby for feeding, fever and form. If your baby is not feeding and you have checked that your baby is not windy, baby is getting up plenty of wind, but your baby has just gone off the feeds, that would be a reason that your baby is not well. Can be a sign that baby is not well. If your baby has a temperature of more than 37.5 and no other obvious reason, baby's not overwrapped, it's not a very warm environment, that could be a sign of infection. And if your baby is off form, whereas your usually placid baby who wakes up, feeds and then settles and goes back asleep, is irritable, is high-pitched cry, is antsy in themselves, very cross, irritable, or the opposite, the baby is very quiet, maybe moaning and lethargic, not waking for feeds, that can be also another sign that your baby is not well.
There are some infrequent but serious conditions that can present in the newborn period. One condition to be aware of would be meningitis, and there are some signs to indicate this, such as rash, irritability, neck stiffness, and usually associated with a fever. But if you suspect your child has these signs of meningitis, it would be a reason to seek medical attention quite promptly, because it is important that baby would receive appropriate treatment early. Chest problems can also present in the newborn period. Most of the time, babies may just have minor snuffles which do not affect feeding or baby's well-being. Chest problems that are significantly affecting baby usually, but not always, affect baby's feeding. If baby is not able to take their bottle or breastfeeds well due to a cough or chest illness, this would be a reason to seek medical advice.